story we are tracking on Urban Debate. The WHO has issued an alert over a made in India cough syrup that is now being linked to the death of 66 children in the African country of Gambia. India has issued an official statement saying that these killer cough syrups are neither sold nor manufactured in India, so there is no reason to panic. The Health Ministry has added that the WHO is yet to share an analysis certificate of the syrup with them, but they have in any case asked the drug regulator to initiate a probe. The company in question is based out of Sonipat. WHO chief Dr. Tedros is saying that these 4 cold and cough syrups in question have been potentially linked with acute kidney injuries as well. Let me go straight across to our panel who is joining us on the broadcast. Dr. Sanjeev Bagai is chairperson of the Nephron Clinic. He is with us. Thank you, doctor, for being with us. Dr. Subhash Salunke is advisor to the Public Health Foundation of India. Dr. Ishwar Gilada is the Secretary General of the Organized Medicine Academic Guild. And we have Professor Sriram Khanna. He is the Managing Editor of Consumer Voice magazine. Thank you, everyone, for being with us. You know, I don't want to spread any panic, which is why I'm going to repeat myself, Dr. Sanjeev Bagai, that the government of India, in an official press statement, has said that neither are these 4 cough syrups made in India, which means manufactured in India, neither are they sold in India. Should we assume that Indian kids are absolutely safe and they have no exposure to these cough syrups or any salts in these cough syrups that could be harmful?
Good evening. Good evening. Thank you for having me, and good evening to all the panelists. So I'll split my discussion in 3 quick parts. One is, I don't want these 4 isolated companies, which are a small part of 4 isolated cough syrups, which are a small part of 3,000 companies which are registered to manufacture drugs in India. And India being one of the largest exporters and production houses of the pharma industry in the world, to actually paint a black brush on all the medicines which are made, manufactured and consumed in India. I must add that the cough syrups are the most common over-the-counter drug, often without prescriptions, which are obtained by almost everyone, even online. Now, the drugs which are contained in these 4 cough syrups, which are from one company only, these contain something which is called as diethyl alcohol or ethyl glycol. Actually, neurotoxic, it damages the kidney. Now, we need to punish and isolate it, the black sheep, not paint the entire industry black. What we need to do is stricter norms on export. We need more regulations as far as the internal consumption and regulation is concerned, but not condemn the entire pharma industry, which is actually a beacon of light for the entire world. Just to add, for a common viewer who's watching this program, cough syrups contain a variety of drugs. All cough syrups are the same. We need to be careful before consuming it. Therefore, it should always be under medical supervision. Some are cough suppressants. Some are mucolytics. That means they make the cough more wet. Some dry the cough, so to say. But this particular drug, which is an ingredient of diethyl alcohol, contains what we call as oxidative stress on the kidney. It is not a common ingredient in any cough syrup. This is, I would say, an aberration to the rule. It needs to be curtailed. It needs to be punished, so to say. But the cough syrups available in India should be used in the correct doses under medical supervision. Thus, they would be safe.
Okay, I understand. You're telling me that don't paint the entire industry as being faulty, because this is actually the fault or the problem with just one. If the government of India is saying that these drugs have not even been manufactured in India, then should the entire pharma industry be coming under question as well? That is a good point that you make, and perhaps not. India has the 3rd largest pharma business in the world. We are the 3rd largest pharma industry in the world, and to paint the entire industry in the same colors may not be right. But Dr. Gilada, can you come in here? I remember some years ago there were 14 children who had died. In fact, not some years ago, if I remember correctly, earlier this year itself.
1986.
No, was it 86 or it was earlier this year as well? We had 14 children die in Himachal Pradesh due to the same contaminants, that is diethyl glycol. I'm asking you, okay, Dr. Bagai is telling us ki bhai, if you have to take a cough syrup, especially for your kid, ensure that the doctor advises you to take it. Ensure that you have a prescription for it. I understand that. I'm asking you, given that the same salts can be used for other cough syrups as well, is there no exposure of these contaminants, as they are called, to Indian children?
Shreya, thank you for having me on the show. I would touch upon 3 points. Number one, the entire world is watching India because India is a pharma powerhouse of the world.
Yeah.
So in such a situation, we should have been very particular. Secondly, we have two different authorities. One is a CDSCO at central level, and every state has FDAs. And they are working at cross purposes many times. Thirdly, we should learn from the history. Because I remember when I was at JJ Hospital in 1986, 14 people died of same contents, but they were in the glycerol. And that was given to the 14 patients which were for eye surgery to reduce the intracranial pressure or brain pressure on the eye. And that glycerol was containing almost 89% of diethylene glycol and ethylene glycol. So contaminant which was allowed was 1 to 2%. It was 89% of that and hardly 10% of glycerol was there. And after that, there was a major commission called Lentin Commission. He castigated 3 health ministers of the past 4 or 5 years. One of the health ministers had to resign 1 or 10 days before the commission report was out because it was leaked to the cabinet. So we have not learned from the history. So we should be very particular about such kind of thing. Children dying in Gambia or children dying in India or any part of the world, they are dying, and that is wrong. That should not happen. And lastly, there could have been some contamination while repacking, etc. Because sometimes when medicines are sold to Africa, they are bought in a big container and then they are doing a recapping. So we need to find out what has actually happened, whether it is manufactured in that Haryana plant and it straightway went from there, or it went to some intermediaries and from there it got diluted. In Africa, Indian medicines are sold in n numbers. Almost 80 to 90% of African people depend on Indian medicine. So under this situation, there are some black sheeps. But as Dr. Bagai said, that we should not paint the entire pharma industry. We should be very particular. But if something is wrong is happening, we should stop it immediately.
Dr. Subhash, help me understand this. The Home Ministry, the Health Ministry statement today is telling us that yes, Maiden Pharmaceuticals is an Indian company and they are based out of Sonipat. This is where they have 2 plants. A bulk of their drugs goes to Africa. But the Health Ministry note is telling us that neither were these 4 particular cough syrups for children manufactured in India or sold in India. What do we understand of this?
Appreciate that some of the manufacturers are permitted by Government of India, DCGI, and Government of India for export only, and this product seems to be fitting into that particular category and not for the consumption within India. That is the reason this particular product has been manufactured in India, could have been manufactured in India, but totally exported to the African country. That's what it apparently, based upon the inputs which we are now getting through media and also from the ministry, it appears to be. But I'm more than this, I'm a bit surprised that WHO's job is definitely to warn the countries, but at the same time, I was part of WHO once upon a time and for a fairly long time. But one, this has happened from the manufacturer is only one company. 2, it is not seen any other country. 3, the WHO could have confidentially spoken or given communication to Government of India, Ministry of Health, and saying that please look into. There are still many questions which remain unanswered. Before getting complete answers for all these questions on WHO side and also from the Government of India, from manufacturer side, why such publicity has been given? I mean, right now, the kind of a damage that is happening or likely to happen to the pharma industry of this country is not excusable. Why Why can't we have been little more tactful? Both, I mean, obviously WHO has more ownership on that side. And number two, what we have been told has been indicated by Dr. Bagai is absolutely true. You know, this cough syrup availability in our country is कुछ भी होता है cough syrup ले लो. Anybody can take whatever they want to take, even for children. That is the great tragedy that neither the doctors community, pediatricians, or the people themselves are trying to be more careful. So I think this particular episode gives us a kind of an warning signal that not only cough syrup, but all the drugs which are available on the counter need to be taken more seriously, and particularly for pediatric use. Unfortunately, in our country, our health system, even though we are saying that we are improving on that side, but in the rural area, why in the rural area? In the urban area, you can get any drug, literally any drug across the counter, and there is not much kind of an legal kind of a binding, even though on the record, on paper it is there, but in reality there are a lot of loopholes. So this episode, very unfortunate one, children have died. This episode needs to is teaching us, is giving us a clear indication that right from center at the peripheral most level, the kind of an checks and balances will have to be there, and doctors will have to play their role. Yeah.
Okay. In this case, in this case, Dr. Bagai, if the drug, it was an Indian manufacturer. I know you have a point to make, but I'm curious about this. If the manufacturer is Indian, and we know the manufacturer is Indian, but the drug has not been manufactured in India and it is not being sold in India, then can we hold the Indian Drug Regulatory Authority accountable here, or will Gambia have to answer that for themselves? That there should have been checks and balances in their country.
Very good question. So, three quick points. The first point is more than 50% of the overall cough syrups are actually used and consumed in the pediatric age group. The maximum under age group of 5 to 10. The second quick point is that in these cough syrups, a lot of variation takes place in terms of ingredients. So it has to be medically supervised. The drug which is being found as a contaminant as diethyl glycol or ethyl glycol is a contaminant which can also be from resins, from packaging, from wallpapering, a vast variety of other aspects outside the production house. So before calling a spade, I think we need a proper forensic investigation that could this leaching during the transport. That means it was okay at the time of manufacturing, but something has leaked into the product during the transport. The last point is, and I completely agree with my previous speaker, WHO's role has been long time cognitively biased. And I think they've done more harm than good, especially in the pandemic. So I won't take WHO seriously. I think it could have been done in a more deft, more dignified, and more politically adept manner, rather than standing on a lamppost and trying to shout, cry out. So I think we need to be more careful. Yes, the warning signals are there that cough syrups need to be monitored. All medication needs to be monitored. But in the end, what I would like to say is India pharma industry is one amongst the best and the most in the world, and it will continue to be so.
This is what he's also said. Before I get to you, this is what he's also said. He's saying that there has to be an increased surveillance of the informal/unregulated market. That is also advised, and telling us it's not just one batch, but the fact that there's a problem with all the 4 cough syrups, not just one batch. Dr. Gilada, could the WHO's communication have been a little more subtle, as it were?
I think WHO is an intergovernmental agency, and Tedros is the director of WHO. He's not director of WHO Africa. So no doubt he is African, so he will have a little bit more sympathy for Africans. As human beings, we all have empathy for anybody who is dying of this thing. They should have been very particular. There is an intergovernmental agency. They should have communicated to government. More so, just 2 months before, Mr. Tedros was in Gujarat with our Prime Minister. And they had a handshake, and not only handshake, they had hugged each other, and they said, we are friends. And after that, he does this thing. I think, as Dr. Bagai said, WHO's role is question mark during all along the pandemic. They never told till today. There are committees after committees after committees for how did COVID come, and they just want to safeguard the interest of China, and that is the role of WHO.
Okay, so you're saying that what the WHO is saying has to be taken with a pinch of salt, which is why we have seen, Dr. Subhash, the Indian government respond first, a little late, many would say, but the response has also been very carefully worded.
Yeah, very true. I think any responsible government will try and do that. And that is the reason, we are all worried because, these kinds of news, even though it is just one manufacturer, it is just few drugs. And we also don't know whether it was a fault at the time of the manufacture. Nothing is certain. On top of that, to put it in an international level, put a news as if the entire Indian manufacturing companies are not following the prescribed kind of conditions and the regulations, it's unfortunate. That's the reason I'm very disturbed. Millions of children are consuming this cough syrup, even though that itself is not a justification. It has to be done very carefully. Still, we have not seen such accidents or sometimes intentional or unintentional negligence plays a role. But in this particular case, I think it was too premature on the part of WHO to sound the warning signal so publicly. They would have been justified to give appropriate warning signal to Government of India very seriously, and then confidentially it could have been worked out in details, and corrective measures need to be taken on long-term basis. It is not just one episode, but how do we ensure that such episodes do not recur? That should be the basis, not damaging a country's pharmaceutical industry.
Okay, so I take away three things from this discussion. A, the WHO has probably jumped the gun. First of all, that the communication could have been better, because what you have done is essentially tell the world that made in India drugs are not safe, and that is simply not true. That's simply not true. We have the third largest pharma industry in the world. We are one of, we are the pharma hub of the world. We've done stellar work during COVID, and, it's an unfair tag to have. Secondly, very importantly, these 4 cough syrups in question are not manufactured in India. They are not sold in India, according to the government of India. And third, that doesn't mean that you can buy cough syrups over the counter. You need a doctor's prescription. That is what the 2 doctors on the panel are saying as well. That's a good advice. I hope all of you keep it. Dr. Bagai, thank you very much for joining us. Dr. Subhash, thank you very much. Dr. Gilada, always a pleasure to see you. Thank you very much.